Once in every 2 or 3 decades, a new technology comes along that can dramatically change the practice of veterinary medicine. In the 1980s, that technology was ultrasound. Hyperbaric oxygen therapy has arrived and has that same potential. It was his destiny to be a racehorse, his biological inheritance to achieve greatness in the sport of kings. The colt was owned by a couple in Central Florida, Niall and Stephanie Brennan, top conditioners of young horses. They had big dreams for the colt they nicknamed Oscar. Those dreams died in the spring of 2004. Their dreams died, and very nearly the horse.
It was horrific. I'd have people come down to see him, and they'd leave the barn crying. I mean, it really was that bad.
First, Oscar developed a severe tendon sheath infection, quickly followed by osteomyelitis or osteitis of the medial sesamoid bone. 3 surgeries and multiple courses of antibiotics over a 5-month period failed to halt the infection.
He was definitely a candidate for euthanasia. Probably about half of his sesamoid bone was gone. Basically, that sesamoid bone was eaten away.
Stephanie and Niall were visiting Kentucky during Kentucky Derby week. They stopped by a facility with hyperbaric oxygen therapy. It was explained to them, and they knew immediately that it was Oscar's only hope for survival. He was on a van shipped to Kentucky within 24 hours.
Oh, it was horrible. I mean, we all cried here the day he went on the van, and I honestly didn't think we'd see him alive.
Hyperbaric oxygen treatments combined with intensive antibiotic therapy produced results.
I couldn't believe it. It was, wow, it was remarkable. He was markedly improved soundness-wise in 48 hours, which is remarkable.
This is Oscar now.
His progress was fast, was rapid. It was pretty awesome. When you have a modality where an animal that would have been destroyed otherwise can be saved, and that's very exciting to me, especially in this business.
If we had sent this horse up there within the first couple of days that the injury happened, he wouldn't have gone through the 6 months of torture that he did.
I think hyperbaric chamber medicine is very revolutionary.
We are supplying 100% oxygen at increased atmospheric pressure, which allows extra oxygen to be absorbed into the plasma, into the bloodstream, and increases the oxygen tension, which promotes better healing.
Basically, you just hypersaturate the blood in the body with oxygen.
What it does is just the pressurized oxygen will saturate it or allow it to dissolve in our plasma. And that's the thing. Plasma does not normally carry a bunch of oxygen dissolved in it. Well, what that will cause, it will cause you to vasoconstrict. You get constriction of your blood vessels. And when you vasoconstrict, you can help reduce edema. Certain cellulitises. Well, the interesting thing is that in areas of low oxygen tension, your peripheral blood, your capillaries have low oxygen tension. That oxygen that's dissolved in such high concentrations will diffuse out. With hyperbaric oxygen, what will end up happening is decreased margination of your neutrophils, decreased margination of your white blood cells, decrease free oxygen radicals, and decrease oxygen bursts, from these neutrophils. So you actually can decrease free radical damage and decrease reperfusion injury.
Hyperbaric oxygen therapy meant the difference between life and death in Oscar's case, and in others with equally bleak prognosis.
I think we're just scratching the surface.
Crush injuries, skin grafts, traumatic lesions, suspensory injuries, tendon injuries, keep going on, areas that may not have good blood supply or oxygen supply. The hyperbaric can help on out. Colics is another good one. Colic surgeries, post-op colon torsions, even in areas of bone infection, if you can get that high osteoblast generation, osteoclast, bone remodeling, you can change a lot of things, enhance healing.
This new state-of-the-art chamber treats horses in a safe, spacious, stall-like atmosphere where the horse is free to move around and lie down if needed.
It works from the inside out. The area in question does not have to be exposed directly to the oxygen.
To me, it's a no-brainer that we really do need it down here.
Well, I know it helped on our case, and it would be nice to have it here to help on other ones that came up.
If you're in a horse population that has high-value dollar horses, this should be something you should have in your practice.
There are lots of patients out there like Oscar. Many do not survive. Hyperbaric oxygen therapy is a revolutionary treatment that gives you, the veterinarian, one more weapon in your arsenal to battle such devastating illnesses as Oscar's. Human medicine has shown its ability to salvage tissue after severe injuries, enhancing wound healing, and assist in healing bone infections. Now, hyperbaric oxygen therapy is available to produce the same miracles for your equine patients. If your practice is a battleground, you're only as good as the weapons you have. Hyperbaric oxygen therapy will set you apart to clearly put you in the forefront of new technologies and innovations.